afternoon, and welcome to the Your Health radio and television program on the radio at AM 1240 KNRY, AMP Cable Television Channel 24, and on the web at www.ampmedia.org. Join our rotating host and their informative guests live every Monday afternoon at 4 o'clock. The purpose of the Your Health radio and television program is to help get, make, and keep listeners and viewers like you healthy. And now, ladies and gentlemen, on with the program.
Welcome to Your Health. I'm Dr. David Morwood. I am a board-certified plastic surgeon. Thanks very much for joining us. This is Your Health radio and television program. And I'm very pleased to have today as my first guest, Jan Dunn, coordinator for the Breast Care Center of the Community Hospital right here in Monterey. Jan, thanks so much for being here.
Thank you for having me.
So Jan, let's start by talking about the Breast Care Center, and I want to learn about your background and what you do for the Breast Center. So you are the coordinator.
That's right.
For the Breast Care Center here in Monterey.
Right.
So tell us a little bit about how you got into this kind of work and how did you get started?
Well, in high school I decided that I wanted to be an X-ray technologist. So I went on to a program for that, and in the midst of doing that, mammography was really just getting started where I was. And it was just very interesting to me, just the idea of doing the mammograms, but the diagnosis too. It's detective work. Even though I'm not the physician, we are very much involved in kind of trying to find the breast cancer. So it was very interesting to me.
So Jan, you said that you started out as an X-ray technician. Is that true?
That's right.
So let's just imagine that we have a young person, say in high school, who might be interested in becoming an X-ray technician. Can you talk about how they would go about that? Like, what does it take to get through the training, and what's the training like?
Yeah, well, they have different college-based programs here. I know Cabrillo has a program, and I believe it is a 3-year program there, although I'm not sure. I didn't go to that program. It's been a long time since I've gone, but they have different college-based programs here. They take many courses. They have general ed courses, science courses, things like that, and then they have courses specific to mammography and breast imaging. And then after you're done with your school, they have a mammography test that you take so that you're licensed in California to perform mammography.
Okay, so Jan, so everybody's got to finish high school. They've got to get a high school diploma, degree.
Right.
And then they go on to take some college courses.
Yes.
Right?
It's an actual program, radiologic technology.
Okay, and the program is how many years in length?
I believe, and I don't know this for sure, but I believe it's 3 years.
Okay, and then following that, they need to pass a test and go through the rigorous path of getting an actual license to be an X-ray technician.
That's
Is that
right? A mammography tech, right.
Okay, so let's talk a little bit about the Breast Care Center. What do you do for the Breast Care Center here in Monterey?
Well, we're located at 1035 Cass Street in Monterey. We are a comprehensive breast center, meaning we do screening mammography, diagnostic mammography, we do different procedures, we do biopsies, we do all types of breast imaging. We also do pre-surgical procedure where they localize where the cancer is for the surgeon. So we do all types of breast imaging there.
So Jan, one of the important functions, or one of the important things that you do at the Breast Care Center is to perform mammograms, right? That's perform mammography.
Right.
Can you describe a little bit exactly what a mammogram is? Because I think there's a lot of confusion. Most men, of course, have no idea what it's like to go through a mammogram. And for those younger women listening and viewing who have never had a mammogram, what do you want them to know?
Well, I would want them to know that it's a very simple test. We actually take, for a regular routine mammogram, we take 2 images of each breast. We do a front and a side picture. It is not painful, contrary to what sometimes people will think. It is not a painful test. We do place the breast on a plate where we have a pad that we use, so it makes it much softer. It's almost like a little piece of memory foam, and it softens it. We place the breast on the pad, and then we compress the breast until the tissue is kind of spread out enough that we can get a good picture. So the breast is taut, but it's not compressed overly so that it's painful. Sometimes it can be a little bit uncomfortable if you have really tender breasts, but it is not a painful test.
And Jan, the purpose of a mammogram is what? Like, what are you looking for?
Well, we're looking for breast cancer, basically. A mammogram is still the best tool that we have to diagnose a breast cancer. It can pick up a tiny breast cancer before it can be felt, and that's the main reason to do it. If you take a group of 100 women that have had a mammogram and you compare it with a group 100 women that have not had a mammogram, it will pick up, you will have 50% fewer deaths of breast cancer on the women that have had the mammogram. So it detects the breast cancer, and that's the whole purpose for it.
Well, great. Now Jan, what about the woman who is concerned about the X-ray or the radiation? Is that a concern? Do you advise women to take that issue seriously? I suppose they need to take it seriously.
Well, of course, but it is a very low-dose procedure. And it's like anything else. You weigh the benefits and the risks. Certainly it's a low risk, and for all the benefits that you get from having a mammogram. But the radiation is low. It's a very low-dose thing. They liken it to a dental X-ray, and they, of course, are decreasing the doses all the time.
Now, Jan, as an aside, you know, most of my viewers and listeners know that I'm a plastic surgeon, and I do a lot of breast implants for reconstructive and for cosmetic. And in addition to looking for a breast cancer, sometimes you can tell a woman about the condition of her breast implant, right? You can sometimes tell if it's ruptured or leaking, et cetera.
That's right.
Which is another very good use in my practice for a mammogram. Now, Jan, briefly, the Breast Care Center opened in March of 2002.
That's right.
About 6 years ago. Now, roughly how many women do you treat or evaluate each year?
Every year we do, I would say, just about 13,000 screening mammograms and about 3,000 diagnostic mammograms.
So 13,000.
That's right.
So that's over 1,000 each month. Well, that's amazing.
It's a very busy place, yes.
Well, good for you. So how do women get an appointment?
We first need an order from a doctor to do a mammogram. So they would get an order from their doctor, and then they would call us for an appointment, or the doctor can fax us an order and make the appointment for the patient.
Jan, now, you know, in terms of public health and public service, we have an opportunity here. So let's remind women who gets a mammogram, how often they get a mammogram, when should they start, what about a strong family history of breast cancer or other pathology? So I know that's a lot of questions.
Yeah, that's okay.
But maybe we can go through step by step. Who needs a mammogram?
Well, every woman age 40 and older should have a mammogram every year. If you have a family history of a mother or sister who had a premenopausal breast cancer, then you want to actually begin doing your mammograms about 10 years before the age that they were diagnosed. So say if your mother or sister was diagnosed at age 42, you would want to have your first mammogram at age 32.
Okay. So again, I think that's very important. I want it to be crystal clear to our audience, right? So every woman needs to get a mammogram at age 40.
Yes, starting at age 40 every year.
Okay. Now, if there's a family history of a direct relative, or a female relative who had a breast cancer, then 10 years before that relative was diagnosed, this patient should start, right?
That's if it's a close a mother or a sister diagnosed with the premenopause.
Mother or sister.
Yes.
So it sounds like if a woman has a strong family history, for example, mother or sister who's had breast cancer, she needs to be on the alert.
That's right.
And call and talk to her family doctor about getting a mammogram even before age 40. Okay. And you said that each year after age 40.
That's right.
Okay. Now, you mentioned the issue about, well, I brought it up actually about the radiation, getting an X-ray, and you mentioned that we're working on ways to reduce the dose. Now, what about the new digital technology? Now, does that mean more radiation, less radiation? Why do we want to think about digital mammograms?
Well, we think about digital mammogram for several reasons. The biggest reason is that the resolution, if you know that you have very dense breasts, the resolution is better with digital mammography. It can see through the dense tissue a little bit better than analog or film screen mammography can. The radiologist has ways to manipulate the image, and that also helps with the resolution. It is much easier for a woman, or it's quicker for a woman to come in and have a digital mammogram. They come in and we do the pictures, and then rather than leaving the room and developing the pictures, it's like your digital camera. Your image comes right up on the screen.
Okay.
And so we can see the images right away, so you get your results sooner also. You know, the images are available. Another thing is that the images can be stored digitally, or are stored digitally, can be sent to different facilities, different doctors. The films don't get lost, as sometimes they can now. They just transmit the images.
Well, Jan, which leads me to my next question, is how long does it take to get a mammogram? Is that an all-day affair? Is it 2 minutes? What's that like once a woman makes an appointment?
It takes 15 to 20 minutes. Right now with the analog, it's about 20 minutes. With the digital, it'll be quicker than that, probably 15 minutes, could be even 10, but we will allow 15 minutes for that.
Okay.
It's very quick.
Now, you know, one of the great things about me having this program is I learn a lot of things myself. So I want you to teach me the difference between a screening mammogram and a diagnostic mammogram. Now, this is going to be valuable for me.
Okay. A screening mammogram is when you have been examined by your physician, and he examines you and you have normal breast tissue in his exam. There are no symptoms of anything, no problems that he has found. That's a screening mammogram.
Okay.
And a diagnostic mammogram is if during the exam he's found something that he's not sure about, like a lump, there might be a lump, or thickening, nipple discharge, something like that. So some kind of a sign or a symptom. And it's really very important to have the breast exam before the mammogram is ordered, so that they can order the proper mammogram, the screening or the diagnostic. Because a screening patient, you come and you have your mammogram and then you leave, and the results are sent to you. With the diagnostic mammogram, you actually meet with the radiologist. We do the mammogram itself. We do additional views, whatever views are needed. We most often will do an ultrasound at that time as well. And if we don't know exactly what it is, if there's a lump, say, or a mass there that we don't know what it is, we'll actually go ahead and biopsy it right at that visit.
Okay. Now, Jan, this may be relevant to the breast center, but I think it's an important question that I should ask. What if a woman wants to learn how to do a breast self-exam, or she needs a referral to a primary care physician? Let's say a woman finds a lump herself, and she's concerned about it. Now, can she call the breast center directly for an exam, or does she need to see her primary care doctor about that?
She will need to see a doctor for an exam to get an order for a mammogram. And you brought up about self-breast exam, and that's a really important thing to do as well. We do offer one-on-one free classes at the breast care center on how to perform self-breast exam. So you just call our center and we can set up you an appointment for that.
Now, see, that information right there, I think, is worth the price of admission alone. Now, I want to repeat that.
Okay.
So we've learned two incredibly important messages, two incredibly important things. Now, every woman needs a mammogram starting at age 40. For women at certain high risk, they need to get started earlier.
Right.
Women should be doing breast self-exams. And at the breast care center, you teach for absolutely free, one-on-one. You can teach women how to do breast self-exams.
That's right.
And how do they go about scheduling that or getting...
All they do is they call the breast care center, and the phone number is 622-2760, and just make an appointment with our nurse navigator. But all you have to do is call and say you'd like an appointment to learn self-breast exam.
Okay, now I want to repeat that number for our listeners and viewers. It's 622-2760.
Right.
And give us the location again of the breast care center.
We're at 1035 Cass Street in Monterey.
So that's right near downtown Monterey.
That's right.
Not far away. Now, Jenny, you know, it seems to me that you can barely pick up the newspaper or a magazine, a common journal, and not read something about what seems to be a very common incidence of breast cancer. It seems to be either we're diagnosing it more frequently or it's more common. Do we know about risk factors? Do we know why it seems to be being diagnosed so frequently?
Well, risk factors, just being a woman and aging is the biggest risk factor that there is. Another risk factor is a genetic risk factor or family history, as we talked about. However, the thing about family history is 85% of the women who are diagnosed with a breast cancer do not have a family history of breast cancer. So sometimes it's a myth that people think, well, if I've never had a family history of breast cancer, so I won't get it. But that's one thing that 85% they don't have a family history. Weight gain after menopause is also a risk factor. And another one is if you have taken a combination of progesterone and estrogen for a long-term period of time. That's also a risk factor.
I know that's been in the news lately. You know, there's a lot of controversies about estrogen. There seems to be pros and cons. If you look at the bone health, the health of the bone and the cardiac health and breast cancer, I know that's a little bit controversial. Jan, we have about maybe 60 seconds left.
Okay.
You know, it's so expensive. Any type of medical care these days, it just costs so much money. I think even if you have insurance. What about women who are concerned with the cost, either their deductible or co-payment, or maybe they don't have health insurance? What about those women?
We have a fund. It's called the Sherry Cockle Memorial Fund. It was actually established by Peter Uberoth, and it is for free screening mammograms to women in need. And we have, all they have to do is call the breast care center at the same number, and we can get an application to them. And if it's a diagnostic test, the hospital has a sponsored care program, and we can get them information about that as well.
Well, Jan, you know, congratulations on the number of women that you treat and evaluate every year, over 1,000 a month. I think that's amazing. And I'm going to give out the number once again.
Okay.
You are Jan Dunn. You're the coordinator for the Breast Care Center right here in Monterey, and the number is 622-2760.
Right.
Well, Jan, so great for you to come on. I hope you come on again. It's such a valuable topic.
I'd love to anytime. Thank you for having me.
Thanks so much.
Okay, thank you.
I'm Dr. David Morwood. I am a board-certified plastic surgeon, and this is Your Health radio and television program. We're going to come right back after a very brief pause for a very good cause. Thanks for being here.